Okay, great. Well, we'll get started if everyone is ready. Again, this is Amy Gott, Chief of Public Policy and External Affairs here at M4A, and I'm really excited to kick off today's webinar, the fourth, actually, in a series that we have been lucky enough to do with our partner Sage over the course of more than a year, actually. They've been amazing partners in helping us bring resources and conversation topics and all kinds of tools and tips to better serve this important population and really supporting our network and doing that. So this, as I said, this is the fourth in this continuing series, is focused on how we can use the processes already in place at area agencies on aging to think about, tackle, and go after better inclusion for LGBT elders, to use what we already have to continue to do even better what you're already doing out there. Quick note on housekeeping, we will take questions at the end, but because all lines are muted, you can't do that verbally, but there's a very simple way in that questions box that you see indicated on the slide that allows you to type in your question. You can add it at any point in the presentation. It's not distracting to presenters or to us, but we will then attempt to toss the questions to the appropriate presenter or presenters at the end of the call. If we're unable to get to all your questions, there is always opportunity to follow up with the individual experts that we're so lucky to have on today's call, so never fear there. So speaking of said experts, we have four folks joining us today that I'm excited to introduce. First of all, I want to introduce Cheryl Weiland, who is a manager of national projects at Sage, and she manages the National Resource Center on LGBT Aging and works closely with the Aging Network to provide educational resources and technical assistance. Cheryl has over 20 years of professional experience in the fields of education, disability, and LGBT older adult advocacy. And she's also been out there doing work similar to what you all have done, because before Cheryl started working with no, excuse me, I'm going to say this wrong. I'm going to say this the wrong way. Let me start over again. Cheryl did begin working with Sage in 2008, but her role wasn't always a national one. She is the founding executive director of the Sage affiliate in St. Louis, Missouri. And there they developed the first regional LGBT referral network of aging providers and the Missouri LGBT Health Access Training network. So Cheryl's been both in the field and dealing with similar challenges to many AAAs, and obviously is now operating on a national level and has been an amazing partner for N4A in really customizing, I think, Sage's approach to what our members tell us they need and we tell Sage. So thank you, and we're of course glad that Cheryl's once again bringing a great lineup. Also tickled to have among our experts two N4A members on the line, because this is again about peer learning and finding out how these experiences of, in this case, LGBT inclusion have worked for our members. So I'm pleased to introduce Linda Levin, who received her bachelor's degree in psychology from the University of Florida and her master's degree in gerontology from Nova Southeastern University. What I just learned about Linda today, and here I thought I knew her pretty well, but she's actually worked at 3 different AAAs before she even got to the one in which she now leads, which is Elder Source in Florida. So that's pretty amazing. She's got a breadth of AAA experience, several in Florida and one even in South Carolina. Linda, at her agency, her current agency, has led their efforts related to LGBT older adults, including the development of their LGBT elder cultural competency training that they developed and LGBT elder-friendly business certification program. So Linda will certainly be talking more about that work. And she's also quite the leader. She is a graduate of N4A's Leadership Institute, has served as past president of the Florida Association of AAAs, an officer at the Southeastern Association of AAAs, which is where she's joining us from today at that board meeting, and we're pleased that she's on our national board here at N4A. Our next M4A member is Erin Grayhack, who is the Community Services Manager at Multnomah County Aging, Disability, and Veterans Services Division. Erin's got her Bachelor of Arts degree in Theology and Religious Studies from Seattle University and has worked with older adults and people with disabilities for more than 30 years. She had been in a long-term care setting originally, but has been with the Multnomah AAA since 1999. She's currently the senior manager of community services, which oversees the Older Americans Act programs, the ADRC, and a significant number of other community-based contracts, including working directly with veterans. So in the last year, Erin and her team have worked with Multnomah County Office of Diversity and Equity to engage in a procurement process that dedicated funds to agencies that deliver services in a culturally specific fashion. So I'll let Erin tell you more about that when her turn comes. But before, I actually have the pleasure of also introducing representative from ACL, who has been able to fund so much, if not all, of this work that Sage has been doing and generously sharing with us. Greg Link is with us today on the webinar. He's the director of the Office of Supportive and Caregiver Services at the Administration on Aging within the Administration for Community Living. And Greg and his team oversee Older Americans Act 3B, 3E, and several of the Alzheimer's disease supportive services programs as well. But of course, like all these other experts, Greg had a past life as well, and before coming to AOA, he worked at the National Association of what was then called State Units on Aging, NASUA, then, now NASUA. And before that, Greg worked at a community level as a case manager and social services manager at Senior Friendship Centers in Fort Myers, Florida. Greg has a bachelor's degree in psychology and a master's of arts in government from Johns Hopkins University. So sorry that I went so quickly. Obviously, these folks' experience and credentials are very impressive, but I want mostly you to hear from them and not from me. So with that, I'm going to turn it over to Greg.
Thanks, Amy, and good afternoon, everyone, and thank you for giving ACL the opportunity to welcome you to this webinar. The topic that we have today, which is planning for better LGBT inclusion, has been a conversation that the LGBT Resource Center and ACL have been having for a couple of years now. And in my role as the federal program officer for the Resource Center, I've gotten to work closely with SAGE to identify training and technical assistance needs of our network of state units and AAAs and providers, and to brainstorm with them about the best ways that we can go about meeting those needs. And so I'm so pleased with the work that's been done and with the resources and examples that are going to be presented today. For those of you who work at the AAA level, you know the importance of the planning process and for ensuring that your programs and services are designed and delivered in culturally appropriate and sensitive ways. And one of the first steps to doing that, to ensuring that your planning processes are inclusive of all populations of older adults and family caregivers, is through an inclusive and broad reach out to the communities that you serve. With the LGBT community, though, we know that there are some unique challenges in outreach and serving older LGBT adults. You know, oftentimes our older LGBT community members have endured a lifetime of discrimination, exclusion, or even just downright hostility from all sectors, from providers of goods and services, healthcare, you name it. And when this is the case, it oftentimes makes these individuals even more reluctant to reach out for help, for fear of similar reactions, and as a result, it becomes increasingly difficult to identify and serve them. And so, for the past several years, ACL, through its grant to SAGE, has made real progress in number one, training the mainstream aging services network to more effectively reach and serve older LGBT adults. We've also been working to sensitize LGBT organizations as to the unique needs and concerns of their older LGBT community members, and SAGE has been providing training and resources to LGBT older adults themselves to help them better plan for their later years. And one of SAGE's most recent accomplishments is the guide that we're going to be talking about today. Its contents are very grassroots oriented and are based on input from across the Aging Services Network. But it also provides some really great resources, links to resources, and offers some really solid real-life examples of where LGBT inclusive planning is alive and thriving. As someone, as Amy mentioned, who started work in the field of aging at the community level, I know firsthand, and I've seen firsthand the challenges that are associated with really appropriately reaching and serving older adults from diverse backgrounds. But I also learned early on the value of the access to information and tools and resources that are practical, that help me do my job more efficiently and effectively. And that's what I believe this resource attempts to do. And so I'm very excited about what we will be hearing today from our two really excellent presenters, and of course from Cheryl at SAGE. So without further ado, I'll turn it back over to our presenters and thank them for sharing their time and their expertise and passion for this work.
Thank you so much, Greg and Amy, for the introductions today. My name is Cheryl Weiland, and I'm the manager of the National Resource Center on LGBT Aging at SAGE. And I'll soon be turning the presentation over to Linda and Aaron so they can share more with you on the firsthand experiences of this work that is so critical to our LGBT older adults. Next slide, please. So I first just wanted to share, many of you have worked with SAGE and the National Resource Center over the past several years, but I wanted to just give a basic understanding of who we are and the work that we do. So SAGE is the country's largest and oldest organization dedicated to improving the lives of lesbian, gay, bisexual, and transgender older adults. Our mission is to lead in addressing the issues related to LGBT aging. SAGE is headquartered in New York City, and they do run the National Resource Center on LGBT Aging, as well as LGBT Senior Centers. And additionally, we have around 28 affiliates across the country in 20 states. Next slide. During our time today, there are several things that we want to accomplish. We want to share with you some of the basic barriers and needs of LGBT older adults, which really, shows why this information is so important as we learn to identify inclusive planning and data collection tools, as well as hear from our peer organizations who are doing incredible work on the ground. And then leave you with best practices as well as additional resources for your own outreach in your communities. So, this work really started with SAGE and the Administration on Community Living in 2010. This was when SAGE's National Resource Center on LGBT Aging was first funded. And over this time, we've really worked very closely with the Aging Network to assist in education and bring you resources that increase the outreach and services to LGBT older adults. And over the past couple of years, we strengthened this focus by seeking direct input from the Aging Network in the development of tools and best practices for greater LGBT inclusion in local communities and states. And this resulted in the guide, which was published in 2017, called Strengthen Your State and Local Plan, a practical guide to expanding LGBT older adult inclusion. And as you'll see on this next slide, you can download this tool and this resource guide from the LGBT Aging Center at lgbtagingcenter.org/planning tools. And in this guide, if you haven't already received a copy or downloaded a copy, you'll see firsthand experiences from your peer organizations such as Elder Source and Multnomah County. And there they really shared, some of the nuts and bolts of the work that they did toward LGBT inclusive planning and services. We also provide examples of inclusive planning goals, strategies, best practices, and additional resources that you can start using today in your work in your communities. Next slide. We recognize that the Aging Network plays a critical role in delivering services to older adults across the country. Yet, as Greg mentioned, many of our LGBT older adults remain invisible, and many may not even seek services due to fear of and experiences with discrimination. And oftentimes those that are seeking services, they remain closeted and don't come out as LGBT. So, we know that there are over 3 million people who identify as LGBT over the age of 55, and this number is expected to more than double by 2030. And research shows that LGBT couples reside in 93% of all counties across the country. And this means that communities large and small, you more than likely already serve or soon will serve LGBT older adults in your communities. On the next slide, we share some of what we know about the barriers and needs for our LGBT older adult community. And we truly encourage the Aging Network to consider LGBT older adults as a population of greatest social need. Some of what we know about our LGBT older adults includes higher rates of living alone and being lonely as they age when compared to non-LGBT older adults. 25% of transgender folks report that they face discrimination when seeking housing and supportive housing in long-term care. And additionally, 40% of LGBT older adults report not being out to their healthcare providers and social service providers. And when an LGBT person isn't out in the care system, then it oftentimes makes it more difficult for us to truly provide the supports and care that they need. All of these findings point to LGBT older adults continuing to be vulnerable as they age and supports the need for outreach and services that are welcoming to our LGBT older adult community. On the next slide, you'll see that, we really wanted to understand as we developed this guide and recognize the needs and concerns of our community. We wanted to understand where was inclusive planning happening and what could we learn from those areas where we were being inclusive of LGBT older adults. And one of the things that we did was we searched the state plans to see, are LGBT older adults being addressed and are their concerns being mentioned, and is there specific planning that's taking place around the outreach and inclusion of LGBT older adults. Next slide. And through this research, which was completed in 2016, and we continue to update this research even today, but in 2016, we found that there were 20 states who included at least one key search term related to LGBT older adult community members. And we also found that the inclusion of LGBT older adults in state plans was often the result of what was happening within our AAAs. And the AAAs were the ones that oftentimes were making sure that the LGBT community was being included and being mentioned in their area plans. This then influenced the state plans and the work that was happening. To help further show the impact at the local level, I now really want to turn the presentation over to Linda and Aaron so they can share with you those firsthand experiences about the work that they've done and give you ideas on how you can also begin this work in your communities. Linda?
Hi, Cheryl. Yes, thank you so much. This is Linda with the Area Agency on Aging and Aging and Disability Resource Center in Jacksonville, Florida. And as Amy said, I've worked with several area agencies on aging over a good number of years. And before I start, I just want to say how thrilled I am to be a part of this presentation. In all the years that I've worked in area agencies on aging and in aging, this work is some of the most rewarding work that I've been a part of. So this is a great opportunity, and thank you again. Next slide. So the most important thing to get started is making sure you have leadership support. This starts with the executive director. This was a personal passion of mine, understanding the needs, and that it was not an area we were engaged in, and that we needed to be for the reasons under the Older Americans Act, serving those in greatest economic and social need and those who are isolated. It's also very important that you have board support, which we were very fortunate here to have. I will say we did lose one board member over this, but that's okay. In the end, the board went so far as to create a work group of staff, board, and advisory council members and created an inclusion statement for our agency, which includes LGBT. We include it in our personnel handbook, and we changed our board member applications and board recruitment to ensure inclusion. That leadership at the top is really key to getting involved in this work and doing more locally. When we knew we had leadership support, we reached out to the LGBT and straight ally community to seek their input and guidance, and we ended up forming a task force which included LGBT elders, younger adults, straight allies, all of which continued to help us develop our efforts and where we were going. Next slide. Some of our challenges to our work included having to build awareness, making sure the LGBT community understood the issues of LGBT elders and that they knew about Elder Source, the Area Agency on Aging, and how we can help. Also, building awareness in the general community of LGBT elders and their needs was a challenge for us. We would not be successful in reaching and serving LGBT elders if they were not even aware of the issues and that we were here. So we started with two big events to build awareness in the community. One was we had a screening of Gen Silent. If you have not seen it yet, it is a must-see documentary. We included with the documentary a panel discussion, which included the producer, Stu Maddox, and one of the older adults that's featured in the film. And then we included a couple of our own local LGBT elders as part of the panel as well. We are now planning our third showing of this documentary in our community with a very positive response to it. We then did a photo voice project, which worked with a group of LGBT elders using digital photography so that they can express their challenges of what it's like to be LGBT and elder. What are some of the things that they face? And we held a community exhibit at a local museum as well as other locations throughout our planning and service area, also very well received. To increase awareness of Elder Source, our Area Agency on Aging, within the LGBT community and in the larger community, we make sure we participate in the annual Pride Festival and the parade and include materials in our larger outreach efforts to the general public, which show our work with LGBT elders. Next slide. So some other challenges, or another challenge, was making sure we and our providers were culturally competent in serving LGBT elders. If we were going to tell folks they can trust us and call us for assistance, we needed to make sure our staff and our providers were trained. LGBT elder cultural competency training is now part of our staff onboarding and is required of all our staff. And in fact, they repeat it, not just during onboarding. We also require the training of our contracted providers as part of our request for proposal. And we monitor to ensure that they go through our competency training. We have since received funding from a local LGBT community fund at our local community foundation to expand the training to other entities beyond our own agency and beyond our contracted providers. We've successfully provided training to skilled nursing facilities, assisted living facilities, senior centers, in-home providers, funeral homes, law firms, and others. Our helpline is particularly important, and so it is important that they are well-trained and can be a helpful resource. The next challenge for us is being able to make the referrals for services and knowing who out there as a resource is in fact LGBT elder friendly. Next slide. All of our effort actually started with our needs assessment, making sure we had surveys and focus groups specifically reaching out to LGBT elders. We've incorporated LGBT elder issues throughout our area plan, including delineating data and the needs of LGBT elders, including describing their unmet needs and what actions we've taken, such as the formation of an LGBT advisory committee, our training, and our outreach activities. Also included in our area plan are the efforts of our providers in this area, our helpline identifying resources as well. We also included specific strategies to reach target populations, reaching the LGBT elders, working with legal service providers to assist LGBT elders with their legal issues, and ongoing promotion of LGBT-specific cultural competency. And we also include requirements, as I mentioned, in our request for proposals, both in our general revenue funded programs and in the Older American Act RFP we do. What was very important to us was that we not just talk the talk, but that we walk the walk. And I think I mentioned a couple of things we do, such as we changed our own HR policies, including protections for LGBT employees. We incorporated LGBT elder cultural competency training into our staff onboarding and developed the inclusion statement I mentioned, which is in all of our materials. We also make sure that we include LGBT-related graphics and images in our literature and materials, and that they are prominently displayed for folks to see and therefore know that we are LGBT-friendly, welcoming, and affirming. We make sure we participate in the larger LGBT conversations in the community as well, not just talking to ourselves. For example, we participate in the Jacksonville Coalition for Equality. I know we're having success when we are receiving recognition from LGBT organizations for our work, when colleagues in Florida and other parts of the country are asking about our work, when folks are calling us for our training, and now we are working with the Community Fund on a local community assessment of LGBT individuals with a clear focus on elders. Sometimes I will say getting started means being willing to be bold, but I believe this is the time to be bold. Steps can be small and not necessarily expensive. I know that this is a concern when we have such limited resources, but there are things we could do, that anybody can do, that are not costly, such as including language and graphics and materials you already use for outreach. Getting training and providing training is also relatively simple. Although it can be challenging, it can also be very rewarding. Changing your own HR policies to make sure they are inclusive, and even developing the inclusion statement, which I mentioned. You know, everyone has a mission statement, everyone has a vision statement. That inclusion statement, that's really special when you can show the world how that you are inclusive of all kinds of folks, including LGBT. All of that is also relatively easy and doesn't cost you anything to do, but does send a clear message. And I will finish just by saying, again, being bold and being committed is very important. And it goes back to it starting with your leadership. And I'm sure there'll be questions at the end that I'll be happy to take. And with that, I will turn it over to Erin.
Great. Thanks, Linda. And I would just like to thank N4A and the ACL and Cheryl for asking me to represent the AAA in Multnomah County in Portland, Oregon, and be part of this conversation. We're really excited about the work that we've done here in Multnomah County. And let's go ahead and go to the next slide. And I would say I'm looking back over our history, and our work really started in about 2012. We had been doing significant equity and inclusion work across the programs that we administer in the AAA in Multnomah County. But some of our senior leaders were part of a community training event, and they did a screening of Gen Silent. And as a result of that screening, we realized that although we had been doing broad equity and inclusion work, we had not been intentional and focused about how we did planning and outreach and engagement with LGBT elders. And so we moved then to a training another screening of the film Gen Silent. As Linda said, if you haven't seen it, run, don't walk. It's a really valuable tool and really, I think, motivating in terms of telling the story of elders in a way that is meaningful and really challenges us to step up to do this work. But we did a screening of that film with all of the management staff, supervisors, managers, senior leaders within our AAA. So folks who are doing the Medicaid programs, who are licensing foster homes, who are doing adult protective services, as well as all of our Older Americans Act programs. And we did a screening of that film, and then we spent time talking about what did that mean and how did we move forward to developing a focused plan for inclusion and program development to serve LGBT elders. And so during that initial couple of years, we did a number of things. We began training for all of our staff. We worked with the team that licenses adult care homes to develop a protocol to license adult care homes, or to do a designation of care homes that are designated as LGBT friendly. And so they went through some specific trainings, and we talked about signage and what house rules would look like, and all of those things. And we've been very proud of that work. And so those were initial. We developed an equity alliance that first was just staff and managers within our own AAA, and then we broadened it out to the several counties that serve the metro area of Portland, so serve some of our suburban communities as well. So we have these two tiers of equity alliance teams to really look at how we deliver these services. And then subsequently, in about 2015 to 2016, we were beginning work to develop our most current area plan. And that work was happening here within our AAA, and at the same time in Multnomah County, our Office of Diversity and Equity was looking at the county's contracting processes and how we could do our contracts in ways that would be more meaningful to our consumers, and what did our procurement processes look like. And so the county was developing definitions around the idea of contracting with agencies for culturally specific services. And so we were doing planning in our AAA to launch our area plan, as well as release a new procurement for all of our services. We contract pretty much all of our Older Americans Act services out to community partners. Multnomah County is the most populous county in the state of Oregon, and we really have felt like the model that we use for our Older Americans Act services, by partnering with community agencies, we really are able to get to our consumers in the most culturally relevant and culturally specific way possible. And so we were doing planning for the area plan, as well as preparing to begin our procurement for services. And one of the things that we were hearing one of the things that we did to develop the area plan was to go out into our communities. And so we did a number, over 16 actually, specific focus groups. There were community listening sessions to inform how we developed our area plan. And in those focus groups, we were very intentional about identifying underserved communities and communities that may experience barriers to accessing services under the Older Americans Act. And so some of the specific communities that we went to gather feedback and talk about what's working for you, what is not working for you, what do you need more of, were our key questions. We did several focus groups that were specific to the LGBT community, as well as one focus group that was specific to long-term survivors of HIV/AIDS. During all of our community listening sessions, what we heard from folks was that what's important is receiving services in a way that is really meaningful to me and rooted in my specific community. So we had that feedback from consumers. We had demographic data that impacted our decision making in terms of how we would do our funding allocations. Historically, we had allocated funds to regional partners, but in this last procurement, and we had a small amount of our funds that we were allocating to partners that we called enhancing equity partners, so agencies that did culturally specific services. But in this most recent procurement, we were very intentional and looked at the community feedback, looked at demographic information in our community, and shifted our funds so that we were allocating about 62% of our funds to regional partners who are expected to be culturally responsive, so able to be present to a variety of consumers and meet their needs wherever they're at. And then we allocated 38% of our funds to agencies that do culturally specific service delivery. And we identified a number of communities, most of which are rooted in racial or ethnic communities, but we also designated funds to serve LGBT elders and long-term survivors of HIV/AIDS. So as we were creating our area plan, we had this rich data from community listening sessions, and we had the opportunity to change how we did our contracting process. And so we were really able to focus on writing a plan that is in the voice of our community members. Some other ways that we look at being really intentionally present to specific communities and finding folks where they're at is to train up our staff and to do focused work. So, for example, as was mentioned in the intro, in addition to doing the Older Americans Act programming, we also have a veteran services team, and so we have county veteran services officers who assist veterans and their families with applying for benefits. So we've worked with that veterans team, and they are a deep presence at Portland Pride, as well as other of our staff do tabling at our Portland Pride events. Our veteran services team has added a graphic of rainbow dog tags to their business card to communicate to veterans who identify as LGBT that we want to partner in a culturally meaningful way. We've done training with our senior health insurance benefits assistance volunteers to understand issues of systems navigation that Medicare can be especially challenging for LGBT and gender nonconforming clients. And so we've been doing specific training with those volunteers to help folks access benefits in the Medicare system. And we've done training we also have a foster grandparent program. And so we've done specific training with those foster grandparents to have a better understanding of the LGBT community and how to be present to the kids that they work with who come from all kinds of families, and how to be understanding and loving and welcoming to those kids. Next slide, please. Another critical area, and Linda referenced this as well, is that it's how do we present ourselves as an agency? How do we, and this is a theme that's very clear in Gen Silent. The staff who are working with the LGBT elders in that film really grappled with, how do I let folks know I want to be supportive to them? I want to provide services in a meaningful way. I want them to feel safe in my agency. And so we worked with our first iteration of our Equity Alliance to talk about the idea of how do we create safe space and how do we communicate that. And so we have rainbow stickers that folks can put on their laptops, on their binders or whatever as they go out in the community. And we spent a lot of time developing a sign that we post in all of our field offices as well as our central office. We've shared the signage with our contractors and community partners. And actually, I shared some of this material at an N4A presentation with Cheryl a couple of summers ago at the national conference. And folks were interested in the signage, and I emailed it out. So there may be other agencies who borrowed it there. And the sign, we were just really intentional, and we validated it with consumer groups. We ran it through our agency leadership and all the way up through our elected officials so that folks were aware that we were intending to be very clear and visible around safe space for LGBT elders and people with disabilities. And so we have a sign with a rainbow triangle that reads, "You are welcome here. We respect your religion, gender identity, race, color, sex, age, national origin, political affiliation, marital and family status, source of income, ability, and sexual orientation. And we do not tolerate harassing or disparaging comments." And on each of those signs, we've made them like dry erasable. And so whomever is the manager or the leader who would be the person to hear about complaints, we post an email where someone could share their concerns if they experience bias or discrimination. And we also the managers identify themselves and their direct dial phone number so that folks could provide feedback. If that's not their experience in our offices, we want to know, and we want to work to improve their experience. Another way that we have created opportunities for folks to feel safe and to know that we're open to having conversations and providing support is we worked with our veterans team on a referral form that is a self-referral, and it's up on our website. And it provides opportunities for folks to make a referral to the Veteran Services team for help, and we created space for people to do self-identification in a variety of categories, including gender orientation and identity. The philosophy behind that being that even by using language around gender identity and including non-binary and other expanded identity options, we're communicating a level of acceptance. We're saying these are all the ways that it might be possible for you to identify, and by listing them, we want you to know we want to be present to you. And so those are a couple of examples of how we create opportunities for conversation and safety. Next slide, please. As has been mentioned, there can be challenges and barriers as well as opportunities to this work. Some of the things that our staff have identified as a barrier or a challenge are that even though we're doing this work and we're open and we're creating signs and we're being open to conversations, systems may not keep up with us. And so forms, we're the government, so forms may not keep up with that. And so there are some limits around technology and state forms. We talk with staff about the idea that forms are limited, but conversation can be rich. We've achieved some gains in some of the systems that we've used. We submitted a QA form that created more ways to identify your marital or family relationships. We're hopeful that someday, gender identity can be some of those issues as well, can be better, more descriptive. We have done work with funders and grantors and outside entities to understand the work that we're doing. We know that the LGBT population represents a variety of generations at this point, and that we are intentional and thoughtful about how we do outreach and how we try to be present to folks. For example, our area plan findings demonstrated that long-term survivors of HIV/AIDS, that there are generational differences there, and that language is powerful, and that we teach folks how to be available to all community members. And we have been working with our county, and as has been referenced, the Office of Diversity and Equity, to really look at what does our employee experience look like. And so we have been supportive, and we're doing active work to look at, to partner on a workforce equity plan and be participating in the development of a strategic plan around that, so that we are kind of putting our money where our mouth is, and that staff have an experience that we're practicing our values and beliefs that all are welcome and everyone belongs. Last slide, please. We continue to have ongoing training opportunities. Some examples of those are, ongoing screenings of Gen Silent. We have done screenings of the film Camouflage Closet, which speaks specifically to issues of veterans who identify as LGBT. We also include equity and inclusion information on our new employee orientation with a focus on serving this community. We offer training opportunities for our staff at national conferences, and an example of that is the Summer Institute of Intercultural Communication that's listed on this slide. And we help sponsor an agency conference, and there is always a track in that conference that's specific to serving this community. And finally, we've been working with a local trainer and speaker around development of a film that is interviews and storytelling by elders who are veterans who identify as LGBT. And we'll be doing a launch of that in our community later in the spring, and that will include a screening of the film as well as a panel discussion and a resource fair, so that we are really looking broadly across the aging network and with our partners to create opportunity for conversation and really focus on how to be available and present to those that we serve. And again, I thank for the opportunity to spend time with you all this morning, and I can do questions at the end too. Thanks.
I just want to thank Linda and Aaron both for sharing, such a rich example of some of the work that's happening in our local communities. And I just can't stress enough how important this is to our LGBT older adults. As we wrap up the presentation today, I want to share with you some of the final things that you'll find in the guide, as well as some of our resources. As we met with and spoke with groups like Multnomah and Elder Source, we really learned a lot from them about how to write these inclusive plans. And as you can see on this slide, it's some of the small changes that really can have the biggest impact. And as Linda said, many of these things do not cost any additional funding for your organizations outside of personal time and commitment. So we really encourage you to think about ways that you can become more inclusive, which helps create secure, affirming, and supportive spaces and programs for our country's diverse aging populations, including LGBT older adults. On the next few slides, we just want to quickly share with you some of the inclusive goals, objectives, and strategies. Specifically, when we met with our area agencies on aging a couple of years ago, as we first started developing this guide, one of the key requests that came out of meetings with our AAAs were actual examples of how to write these LGBT inclusive plans and what that looked like. And so as we did our research, we put together several different examples, and just wanted to briefly share with you some of those today. As you will see on the 3 slides that we'll be running through, we have goals, objectives, and strategies. And typically what we see as a goal is being more broad in how we're going to provide information and access, as an example. On the next slide, you'll see the objective. And again, it's very broad in nature. What is the objective of, reaching folks in our communities through information and access? And then finally, we have on the next slide, strategies. The strategy is where we really start to see that focus narrow in on serving, not just older adults, but specifically older adults who are vulnerable and at risk in our communities. And this is where you will see, that more narrow focus as we think about the folks who are truly at risk in our communities. As you go through the resource guide that we've developed, you'll see several examples. We encourage you to use those examples in your own work in helping to write your area plans. Next slide. And we also took the best practices directly from the field. So these best practices come through the stories that were shared by Elder Source, Multnomah, as well as several other state units on aging and area agencies on aging. And, as we talked about today, one of the first steps is making sure that our staff, as well as agencies and providers that we work with in the community, have training and understanding of cultural competence for serving LGBT older adults. Developing partnerships with LGBT organizations, straight allies, and other key contacts is critical as you develop plans and design programs and services that are inclusive to LGBT older adults. So as you work through the guide, you'll learn more about these best practices and how they can be implemented in your community. Next slide. We also have a number of resources that are available and included throughout the guide. And these are just a sampling of some of those resources here. one of the big requests that we oftentimes get is around demographic data. These resources that you'll find here are based on academic research as well as organizational research from groups such as SAGE, the Movement Advancement Project, and others. And this is data that you can take and use in your communities to help better understand the needs of LGBT older adults. Next. There's one key slide or resource I want to point out to you here. We heard both Linda and Aaron speak about training, and in their organizations, they're providing much of their training in-house. Some organizations may not have that expertise in-house, and the National Resource Center works very closely with our training arm, which is Sage Care. And through that program, we can provide all of the AAA organizations free of charge webinars, that can help you and your staff become more LGBT culturally competent. So if you'd like to learn more about the training program, please go to sageusa.care, and you can fill out the Contact Us form there, and we'll get in touch with you about the trainings that are available. There's also a number of free educational resources on the National Resource Center website, including a tool that was developed with ACL called Building Respect for LGBT older adults. And finally, I just want to point out the guide again. This was really the driving force behind this webinar today, and sharing with you some of the best practices from the field and stories from the field that are truly making a difference in the lives of LGBT older adults. I believe we now have time for a few questions. So I think we can turn it back over to Amy and Rebecca.
Okay, great. Thanks. All right. Well, Rebecca's pulling up. Folks, send your questions in that question box I mentioned before. What you're interested in may be of interest to everyone else on the webinar too. So while I promise direct access to our panelists today, let's keep this dialogue going since we have a few more minutes. I'll throw something out while we see the questions coming in. And this is for anyone to answer, really. I mean, if you're working at a AAA, so asking this of the panelists, theoretically, because obviously Linda and Aaron's AAAs are well beyond this, but if you're working for AAA, and this webinar's got you excited to try a few things, but the agency is really, this might be the first time they're saying, oh, inclusion for LGBT older adults. What is your tip on where you even start there? I know you all gave lots of action steps on just how amazingly far you got and what your challenges were along the way, but let's just, with trying not to overwhelm people, remember that every step forward is in the right direction. So any tips on where you would start? If you knew it was a AAA, this is not something they had grappled with, it's certainly not in a formal way.
This is Linda, and that's a great question, Amy. I want to say, SAGE has some really great resource materials. They have the reports, they have the data, they have toolkits. What a great place to learn about the topic, to get some tips, to get some help and some guidance, and they're a wonderful resource, and they have wonderful materials on their website. The other is, I think it's very important that people hear from the community, and Aaron spoke about this too. We both reached out to LGBT elders, to LGBT younger people, to straight allies who had the information we needed to learn, because this was not an area we knew. We're in Jacksonville, Florida. So, we had our challenges. This was not a recognized need necessarily. Recognized need. It was a need, but it was not popular. And so we had to reach out. We had to look for people who can help inform us. And I think doing your homework through the SAGE resources and doing your homework, the people in the community who you might start with one person who knows 2 or 3 other people to connect you with. And that's how we started. And we started small. We started with that, and then it just took off from there.
Okay, hi, this is Erin.
No, go ahead, Erin.
I would just say ditto that, and I think for us also engaging with our management team first to really reinforce the need, and then to move out with our staff and then out into our community.
Great. That stole my next question, but that's okay because we've now got
darn it.
No, it's good you answered it. I kind of wondered about that lateral movement over into your colleagues. Okay, one specific question for Erin. A participant is curious about what unique needs were identified in your conversations with long-term survivors of HIV.
Key issues, actually in all of our community listening sessions, transportation was a huge issue and need identified in all communities, and the long-term HIV AIDS community was no different in that area. And then I think the other areas of need were around physical and behavioral health and linkages to those systems and building of community.
Okay, great. What has been the conversation in your agencies, or Cheryl, you can tackle this at a national level, regarding the, whoops, my thing went away. I want to get it right. Inclusion of the Q at the end of LGBTQ, whether that's queer or questioning. Can you guys talk a little bit about that?
Yeah, so this is Cheryl, and I'll kind of share some of our thoughts around this right now. For many of our older older adults, queer was oftentimes seen as a very derogatory term, and oftentimes still has a lot of stigma attached to it. So, it's not a term that we typically use unless the person is using that term to refer to themselves. As with everything, language evolves over time. And I think, 10, 15 years from now, you may see that term, becoming even more mainstream and used more often. But for now, it's really not a term that we use unless a person uses that term to refer to themselves.
Okay, great, thanks. Another question. What has been your experience in training the Area Agency on Aging staff directly? This could be any of you, both in training your peers, or certainly SAGE has played a major training role in this space.
This is Linda. In training our staff, they have been very open, very accepting, very responsive. We have had over the years LGBT employees that have been coworkers of staff, and so having the training was really helpful to everybody. So again, we were very fortunate. We had a very open staff who have been getting diversity training and inclusion training, and this has just been a part of that process. And so it wasn't difficult for us at all to make sure that everyone was good with getting the training.
Yeah, and this is Cheryl again, real quick. I've been providing LGBT trainings now for over 10 years, and I really feel like we've come a long way in the past 10 years, and I think our staff at our AAAs and many of our community providers truly have a sincere interest in learning how to better serve LGBT older adults. And as more and more of us recognize that LGBT older adults are in our families, in our communities, our neighbors, our friends, it really, I think, goes a long way for us as professionals to say we want to ensure that all older adults, including LGBT older adults, receive quality care in our communities.
Amy, this is Linda again, just to follow up. When we do our training, and this includes our own staff as well as in the community, we start our training with the fact that we're not here to change hearts and minds. People are going to feel and think what they feel and think. But this is teaching people how to be respectful, how to treat people with dignity. And to do that, you have to understand where they're coming from and meet them where they are. And by the end of the training, so it kind of lets them off the hook of they don't have to feel like they have to be convinced of anything, and they are open to the training. And then by the end of the training, we have changed some hearts and minds. Not everybody, but a lot of people. And as long as they don't feel coerced and they get the information in a way that's positive to them as well, then the reception has been there for the most part.
Okay, that's great. Thank you. And Linda, you developed that training, but you also train others who would be interested in that curriculum, right?
Yes, we do. We do it locally. We do in-person training, and we also make it available through webinar.
Okay, great. And Cheryl, someone asked a question, wanted to make sure they understood as to what your current offer is through the National Resource Center on webinar trainings for AAAs. So if you could just repeat that, if you will, offer.
Sure. And my email is up right now, so anyone that wants to have a follow-up conversation, please feel free to email me. But through the National Resource Center and our partnership with our training arm, Sage Care, we have a webinar series that is free of charge to all AAA organizations. So if you are interested in having your staff trained, we roll out webinars once or twice a month that you can sign up for, and staff can take as many of our webinars as they're interested in. So, please feel free to go ahead and contact us. And if 25% of your employees complete that training, then you're awarded the Sage Care credential, which, is kind of an outward sign that you can show the community that you have a commitment to LGBT inclusion.
Okay, great. Thanks for clarifying that. Okay, last question for the group. I know I'm going a few minutes over, but I know we started a few minutes late, and there's just great material here and questions to continue to come in. So let's talk about, how do you actually evaluate the providers if they're being inclusive? So anyone who could talk to how you would actually evaluate that. And then a very related question, so I'm going to put them together. After you have these initial trainings with AAA staff or providers, how do you really ensure that they then go on to actually be inclusive? So any thoughts on those very similar topics, if not one and the same?
Well, this is Linda again. That is probably one of the greatest challenges. Because we do require the training of our providers that we contract with every year on an annual basis. And it's part of their bidding for the RFP for our funding, whether it's state-funded programs or Old American Act-funded programs. And we can mandate training and they can take the training, but that's no assurance. And what we don't know through our systems, and this goes back to some of the challenges that Erin mentioned, that systems sometimes are slow to change. We have no way of knowing in our databases if our clients that we're serving are LGBT. There's no question on the assessments. So unless we get a complaint that someone wasn't treated well, we don't really know. We do monitor our providers, that they have gone through the training. We do share with them our policies that we have to help them be considered LGBT friendly, things that they could do, and we give them that technical assistance. We're working now with funding from our LGBT Community Fund through the Community Foundation on an LGBT elder-friendly business certification, which covers various areas besides just the training, so that we can make referrals to folks, to businesses that we do know meet criteria to be considered LGBT elder-friendly. But the monitoring of it, that's a difficult thing. And without knowing who the clients are, to be able to talk with them and identify them and see how things are going, also very hard to be able to know how folks are doing.
This is Erin. And yes, all that. And additionally, like, for example, in our adult care home program, we have a really strenuous kind of program that that the adult care homes have to go through before they achieve the designation, and then the licensors are out in the homes and kind of monitoring in terms of posting of signage and reviewing house rules and those kinds of programs. And the same with our contracts with our community providers who are contracted for culturally specific services, we're doing site visits and trying to make sure that we've publicized our contact information as well. So, but again, it really is going to come down to, folks raising a concern.
Okay, much as I think we could keep the questions going because there's some coming in, I want to be cognizant of the time of our presenters and everybody else who doesn't want to jump off and miss anything. So we are going to wrap this up, as hopefully was mentioned, and we've been trying to get back to. Yes, we will have the available as well as this webinar. So hey, maybe that's your first way, is to share with any other allies within your organization to start thinking about how you can build this into your planning process. It's such a fantastic, I think, approach, and I just want to reiterate how much M4A appreciates the work that Cheryl and Sage have done with the Source ACL funding over the past several years. They really didn't come and as Linda said, it wasn't a change hearts and minds all in one night. They were saying, where are your AAAs, and how can we work together to get here? What are their needs? And have just been wonderful partners in really hearing what it's like, the wide range of experiences of the Aging Network, and then build products to reflect what our members said they needed. And did what we did today, which is pull up those innovators at the front edge here who've had these experiences and showcase folks like Linda and Aaron and many of their other peers in other parts of the country and say, look, they did it, you can do it too. So just want to put that final stamp of endorsement, which at this point, if you're still in the webinar, you don't necessarily need, but know how much we appreciate that this was really customized. It wasn't just general cultural competency practices. It really reflects, hey, how can the Aging Network itself use what we have to do an even better job? How can we use that as a way to have conversations that in some communities not as welcomed as in others? How can we continue to better ourselves? So our deepest thanks to Cheryl and Aaron and Linda and Greg Link for joining us today, and to all of you for taking the time out of very busy schedules to learn more about this topic. We look forward to hearing from many of you in the future as hopefully this and other webinars and resources you're able to connect with help advance your work around inclusion in communities across the country. So thank you very much, everyone, and let's go get our afternoons.
Thank you so much.